As a patient, I often am asked, what is a NET? I mean, what is it that you have? What type of cancer is this?
I've been explaining what NETs is to family and friends for a number of years now, and I found it pretty challenging due to the unique complexities of our specific cancer.
NETs has been the process of learning how to engage with that initial diagnosis of a tumor cancer, and then realizing and trying to explain to friends and family that the words remission or you look so healthy don't necessarily always apply to our unique category of disease.
You kind of have to go to the right places to get to answer some of the right questions, and sometimes you're not even sure what question to ask.
This is not the cancer that everybody's used to hearing about, especially a patient that has pancreatic neuroendocrine tumors. This is not pancreas cancer. A neuroendocrine tumor of the rectum is not what you think about when you hear rectal cancer.
Most of the time when patients develop cancer, it's in the lining of their internal organs. And the lining of the internal organ yields a cancer called adenocarcinoma. So 95% of the time, that's what we're talking about. However, about 5% of the time, there are hormone-producing cells that are either heaped up in your glands or it can be scattered in your organs like your lungs or your small bowel. And those hormone-producing cells grow for whatever reason, we don't quite know why.
These are tumors that are produced by special cells in the body called the neuroendocrine cells. The way they call neuroendocrine is because they produce hormones, which can produce the symptoms that we talk about.
They're slower growing cancers than other cancers that we care for, and they're cancers that can start anywhere in the body. I always tell my patients there is nothing they did or didn't do to get this problem. We truly don't understand why they develop. There tends to be nothing that we can see in the environment or in the diet. Very, very rarely or from an inherited gene, but that's super rare.
Most of the data that you will read online about lung cancer and pancreas cancer and rectal cancer, colon cancer, really does not apply to neuroendocrine tumors.
And neuroendocrine cells are the cells that actually make hormones, because we have neuroendocrine cells all throughout our body.
And because they're slower growing, sometimes we don't know that they're there until much, much later than when they developed.
So compared to traditional cancer we might hear about, they take years and years to get to the point where they are, and people can live with those cancers for years to come.
They cause everything that a typical cancer does, and actually more, because sometimes you have hormone symptoms that come with it, and that's an extra added burden which most other cancers don't have. But here, instead of things happening in a year, 2 years, it just takes longer for most of the things to happen.
And so I think the thing about neuroendocrine tumors that's maybe different from other types of cancers is the heterogeneity of them.
They can make hormones or biochemicals that can make people feel sick, and that might influence the way that they feel and their quality of life significantly. Because of that, we treat those tumors or cancers in very different ways, where the goal is really about getting control of the disease, much like we would control of a chronic disease like diabetes or hypertension.
It's still cancer. We have to treat it accordingly. We have to manage you accordingly. And it's something that we can deal with, but it needs to be dealt with.
Most patients with neuroendocrine tumor can live long, healthy lives, even if they have more advanced disease. And so not all hope is lost, and they just need to get into the right hands with the right group to get more information about their specific tumor. And then that will tell us a little bit about how long you're going to live and what treatments we can give you to try to extend that as much as possible.
We may not be able to get rid of all of it, but we might be able to control it for years to come with different type of treatments. That might involve a lot of different therapies, either combined together or sequenced together over time.
While NETs isn't often curable, it is treatable. And the treatments aren't like other cancers, where your hair falls out and you lose a lot of weight. There isn't a clear algorithm, and people are often in and out of treatments. And there's often a lot of decisions to be made.
But I think the most important aspect of neuroendocrine tumors is looking into the type of neuroendocrine tumor you have and understanding how that's going to impact life over time.
Going to a doctor that really understands the disease is critically important so that we could better understand your tumor and what we need to do for your disease.
It does have a rich community of people diagnosed with the disease, and so I think really reach out to others to learn more about the disease.
So definitely talk to the NET advocacy groups, physicians, and other patients to kind of get more information to really get started on this path that you're heading on.
My husband is living with the same type of cancer that Steve Jobs and Aretha Franklin had. But while celebrities might have made NET famous, it's important to know that there are about 180,000 people living with neuroendocrine cancer. So it's not as rare as previously thought. The challenge is learning to live a new normal with the disease, because it is possible to live richly and fully and to thrive despite living with neuroendocrine tumor.